Dr. Ami ma'am, today we are talking about the innate need of replacing protein because India is a carb-heavy country.
It has been seen that only 18% of our urban population and 5% of our rural population consume good quality of protein. Now, as you spoke about my study, let's go a little flashback. When we saw most of the studies which were done with these protein supplements, what we saw was that they were done as complete meal replacement. Over a period of time, what happens is people do not want to continue that. One is formula fatigue. Second one is they feel left out when they're having their breakfast with their family. They want to also eat what the family is eating. So this was the exact premise of our study. What we thought of is why not partially replace the breakfast, which is the first meal of the day, with the protein supplement and see its effect. So what was the conclusion? So what we saw in the study was that when we evaluated the postprandial glycemic response, there was 56% reduction in the postprandial glycemic response right from day 1 in the test.
Hello,
Hi.
Dr. Ami. Please introduce yourself.
Yeah, so I'm Dr. Ami Sanghvi, consultant diabetologist, practicing in Mumbai since last 18 years.
Very nice. I'm Dr. Nimmi Mulwani. I am from Ahmedabad. So, Dr. Ami ma'am, today we are talking about the innate need of replacing protein because India is a carb-heavy country. Our meal revolves around carbs and our days revolves around our meals. So, we heard you did a fantastic study. Congratulations for that.
Thank you so much, Nimmi.
Can you elaborate on the study you did?
Yeah, so as you rightly mentioned, Nimmi, that we are a very carb-heavy country. Practically all meals of our day, be it the breakfast, lunch or dinner, would have a heavy content of carb. In fact, the START study from our country has shown that pan-India, the consumption of carbohydrates is very high. Now, when we looked into our patients, when we evaluated our patients, what we found is that breakfast is one heavy meal of the day. Protein replacements have been spoken about, dealt with. When we look at the protein intake of our population, it has been seen that only 18% of our urban population and 5% of our rural population consume good quality of proteins. So if you can put it this way, that we are in protein poverty.
True.
We do not consume good amount of protein in our diet. Now, as you spoke about my study, let's go a little flashback. When we saw most of the studies which were done with these protein supplements, what we saw was that they were done as complete meal replacement. So, a complete meal was replaced with a protein supplement.
True.
Over a period of time, what happens is people do not want to continue that. One is formula fatigue. Second one is they feel left out when they're having their breakfast with their family. They want to also eat what the family is eating. So this was the exact premise of our study. What we thought of is why not partially replace the breakfast, which is the first meal of the day, with the protein supplement and see its effect in terms of glycemic excursions, in terms of the glycemic response. Does it increase any ghrelin or insulin levels, and how is the energy expenditure throughout the day? So this was the premise of our study.
Okay, you correctly said that when a person is eating separately than the family, you feel being left out. And of course, we don't want to start our day like that.
Absolutely.
So how did that study progress?
So what we did was, we did an analysis, and where we found from other studies that we need at least 25 patients to be enrolled in the study. We got in 42 patients. Later on, we had 4 dropouts because they were not ready for multiple pricks. 38 patients were enrolled in the study. All were type 2 diabetic patients with an A1C between 7 to 9 and with an age group of between 18 to 65. BMIs which we took was from 22 to 29.
Okay.
Now, when we started with the study, what we did was that we divided them into the test group and the control group. Okay, now for the test group, it was a 14-day study. For the first 5 days, what we did, we called them to our clinic and we replaced a meal partially with the protein powder and partially was given. On the first 3 days, we gave them 30 grams of upma and the next 2 days, 20 grams of poha. In the partial protein supplement which we gave them was 3 grams of protein in the 200 ml of toned milk. Okay. It was standard. We used Amul toned milk, we used MTR poha and upma, so it was standardized between all the patients. Now, after 5 days, what we did was there was a washout period from 6 to 8 days, and the 9th day again, the test group people went to the control group and the control group people came to the test group where we gave them again the same thing. Now, the people who were in the control group also got breakfast of poha and upma, but it was a full meal. Calories were taken care of. Both were isocaloric, around 325 kilocalories in the test group and 327 kilocalories in the control group. Registered dietitians were involved. The research assistants were in constant touch with the patients whether they are comfortable throughout the study. On the first day, the patients were called to the clinic on the first day, 9th day and 14th day. On the first day, we took multiple blood samples at every 30 minutes interval, 0, 30, 90, up to 180 minutes. Then a CGM was put on them and they were called on the 9th day to reevaluate their statistics. We measured their blood pressure, their weight and everything, and on the 14th day, finally all the measurements were done and the CGM was removed. And then we analyzed our data.
Okay. So, you did not completely stop their carb intake, but you gave them routine food and added a supplement.
Yes.
So, it took care of the protein requirement also, and the patients were also comfortable because they are eating comfort food.
Yes.
So, what was the conclusion?
So what we saw in the study was that when we evaluated the postprandial glycemic response, there was 56% reduction in the postprandial glycemic response right from day 1 in the test group. Okay, so it was much better than in the control group. Another thing what we saw that when we evaluated the insulin and the ghrelin levels, there was not much difference in the ghrelin levels, and the insulin levels also, there was a slight increase in the insulin levels in the first 30 minutes, but then the insulin levels also settled out. So all the more reason that the patient is not developing any hyperinsulinemia or insulin resistance. Another thing what we evaluated and we found out was the energy expenditure in the test group who were given a good amount of protein was much better from the protein part than the carbohydrate part.
Correct.
So because the protein intake went up to by 8 to 10% than what the patients used to be taking. So it actually helped them to improve their protein intake throughout the day. Another thing, when we put them on the CGM and we looked at their MAGE, the mean amplitude of glycemic excursions, what we saw was that the intraday, the patient's glycemic variability was much better than the patient in the control group. So even if you give a good protein supplement in the morning, the patients had a good glycemic variability throughout the day. Though the night variability was not much of a difference, but throughout the day, the intraday variability was much better. So somewhere you are helping your patients with glycemic variability, you are helping the patients to bring down their postprandial peaks.
Correct.
You are helping the patients to get a better energy expenditure for protein. So I think it's a win-win situation everywhere.
Absolutely, and it is very important to match at least 0.8 grams per kg weight of protein.
So this was getting there.
Yes, and if we are reaching that by replacing a partial meal instead of a complete meal replacements, which make people or our patients living with diabetes feel out of place. This is I will not call this a compromise, but I'll call this a better situation than they are at with low protein intake.
Absolutely.
So that's actually a wonderful premise that you did and a great study, and it proved that we can not completely relying on outside protein sources. We are giving them half and then continuing their carb intake.
Absolutely.
So if you have to give a practical tips to our protein poverty rich country, what would it be then?
So as we have done this study, though we have done with patients with type 2 diabetes, but I think it's applicable for all
Everyone.
of us to start replacing a part of your meal with some protein supplement. Now that will not only suffice your protein requirement, it will help you to utilize your energies better, maybe have a better quality of life, cut down on sarcopenia, which is again too much prevalent in our population, and lead to a better quality of life.
Sure, because if we maintain the muscles early and well, it leads us to next 30, 40 years, 50 years. So that's
life.
that's good. It's a good life.
Absolutely.
So thank you so much.
Thank you.
It was indeed a pleasure talking to you as
It's always a pleasure being with you, Nimmi, on the same platform.
Thank you so much.
Thank you.